Good evening and hello, everyone. I'm Timothy Ortiz, a registered nurse and doctorate of nursing practice candidate at West Coast University. In today's discussion, we will focus on how to prevent catheter-associated urinary tract infections, commonly known as CAUTI. We'll be reviewing the guidelines on CAUTI prevention, along with appropriate scenarios for using Foley catheters. One crucial strategy in preventing CAUTI is to avoid the use of catheters unless there are clear indications for their use. It's essential to explore alternative options before opting for a Foley catheter. And we will discuss a variety of those alternatives in this discussion. Let's dive in. Urinary tract infections fall under the category of healthcare associated infections. And it's important to note that 75% of UTIs are associated with urinary catheter usage. Catheter-associated urinary tract infections, CAUTI, is a major healthcare problem recorded in many healthcare facilities, with the problem being common in acute care hospitals. Research studies show that CAUTI accounts for approximately 9% of all hospital-acquired infections. Catheter-associated urinary tract infections, or CAUTI. These infections are alarmingly common, affecting a significant number of patients. However, research indicates that a staggering 65 to 70% of these infections are preventable. This statistic highlights the need for improved practices and protocols in catheter management. I want to highlight key initiatives for preventing catheter-associated urinary tract infections, or CAUTIs. First, targeted education for healthcare staff is essential. By enhancing their understanding of infection control and catheter maintenance, we empower them to make better decisions. Second, implementing automatic stop orders for catheters is crucial. This ensures timely assessments and removal, reducing the duration of catheterization and consequently the risk of infection. Lastly, using standardized checklists helps ensure that best practices are consistently followed each time a catheter is used. By focusing on these three initiatives, education, stop orders, and checklists, we can effectively reduce CAUTIs and improve patient care. Let's work together to prevent catheter-associated urinary tract infections or CAUTIs by applying our care bundle. So, what practices should we include in this bundle? First and foremost is proper hand hygiene. This is essential for eliminating harmful microorganisms that can lead to healthcare associated infections and effectively prevents CAUTIs. Next, we have the shift needs assessment. This means only inserting and indwelling Foley catheter when absolutely necessary and removing it as soon as it's no longer needed. Minimizing catheter use and its duration is crucial, as prolonged use increases the risk of CAUTIs. Now, let's ensure proper placement of the device. This step is vital in preventing complications. We must also emphasize proper pericare to maintain hygiene and reduce infection risk. Lastly, always maintain a closed system to protect against contamination. Together, by following these practices, hand hygiene, assessing needs, ensuring proper placement, providing pericare, and maintaining a closed system, we can significantly reduce CAUTI rates. These infections can lead to several serious consequences, including prolonged hospital stays and increased morbidity and mortality. Patients often experience discomfort and in severe cases, they may develop sepsis. Moreover, CAUTIs contribute to higher healthcare costs due to longer treatment times and additional interventions needed to manage complications. Let's discuss the implications of catheter-associated urinary tract infections, or CAUTIs, for patients' safety. First, CAUTIs can lead to higher healthcare costs and longer hospital stays due to additional treatments. Second, they negatively affect quality of care and patient satisfaction. Lastly, healthcare professionals are crucial in preventing CAUTIs by adhering to best practices. Some compelling evidence supporting the prevention of catheter-associated urinary tract infections, or CAUTIs. Studies indicate that an impressive 65 to 70% of CAUTIs are preventable. This highlights the importance of effective prevention strategies in our healthcare settings. Additionally, research shows that implementing these prevention efforts not only reduces infection rates, but also improves overall patient outcomes. I want to highlight Florence Nightingale's infection control theory. Nightingale emphasized the importance of collaboration among healthcare professionals to prevent healthcare-associated infections. By working together, we can improve infection control and enhance patient safety. In summary, applying Nightingale's principles is vital for preventing infections in our healthcare settings. The key evidence-based strategies for preventing catheter-associated urinary tract infections, or CAUTIs. First, educating healthcare teams on CAUTI prevention is essential. Second, using proper catheter insertion techniques is crucial to reducing infection risk. Lastly, clear guidelines for catheter use and timely removal are vital. We face a significant challenge with the lack of knowledge and training among staff, which directly impacts our prevention efforts. Second, the issue of overworked staff and limited resources compromising our ability to maintain effective infection control practices. Finally, communication barriers surrounding catheter removal must be eliminated to prevent delays and potential complications. The implementation of CAUTI champion teams and their essential role in preventing catheter-associated urinary tract infections, or CAUTIs. These teams focus on educating staff, monitoring practices, and ensuring adherence to prevention protocols. By providing the right knowledge and resources, we can create a strong culture of infection prevention. The main goal is to reduce CAUTI infections and enhance patient safety. Our long-term goals for reducing catheter-associated urinary tract infections, or CAUTIs. Our primary aim is to achieve a substantial reduction in CAUTI rates over time. This will enhance patient safety, lower mortality rates, and reduce hospital costs. Additionally, we plan to establish standardized prevention practices across healthcare institutions to ensure consistency and effectiveness in our efforts. In summary, we are committed to creating lasting improvements in CAUTI rates for better patient outcomes. As we conclude, I want to issue a call to action for all healthcare professionals. It is imperative that we adopt evidence-based practices for preventing catheter-associated urinary tract infections or CAUTIs. To effectively reduce CAUTIs, we must emphasize the importance of collaboration among team members, ongoing education, and strict adherence to established protocols. These elements are crucial for ensuring patient safety and enhancing the quality of care we provide. Let's commit ourselves to these practices and work together to create a safer healthcare environment for our patients. Thank you for your attention, and let's make a difference.